this is a big thing. I did this about 3 years ago, and this is a massive peel. It takes about 900 layers off. Just kidding. I will have not a spot on my face, and I will look like I have infant skin. And this is the super uber my secret weapon, Dr. Khadavi. Dr. Khadavi, are you going to torture me right now? What are you going to do?
We're going to give you a little torture, but you're going to look fantastic.
Okay.
What we're going to do today, we're going to do the deep TCA peel. We're going to do a 35% TCA peel. It's not 900 layers, but it's going to be 50 layers of your skin, the top layers of your skin coming off. Don't worry, you do have about 900 layers over there. So
it's not going to be too thin in my skin?
It's not going to be thin. Actually, a lot of people think when we're doing the peels, you're going to be losing the thickness of your skin. However, what happens is your body reacts, just kind of like when you get a scar, your skin becomes thicker in the area where you have your scar. When we're doing the chemical peel, we're injuring the skin, taking off the top layer, bringing new skin cells there, and actually your skin's going to get thicker. So, you know, it works on the fine lines, it works on the wrinkles. Similar like when people are getting those deep ablative lasers when their skin becomes raw for like a week or 2 weeks. The deeper you go, depending on the patient, the more regeneration of skin you're going to get, the more tightness of your skin you're going to get. So what we're doing is we're laying in the chemical peel, which is the TCA, around her upper forehead area. She's going to start stinging in a minute because the peel is penetrating the top layer of the skin.
She's stinging.
Yeah.
Are you going to wash this one off before we go into the others?
Yeah, so we're going to do 1 quadrant at a time. Because it's a deep peel, other peels we may do all the quadrants, means all your whole face at one time, but this we kind of divide it, you know, because you want to see how you tolerate one area and don't just throw much pain everywhere else. And what we're looking for is actually her skin color changing, and what's happening is the skin color is becoming white, and that's how we know how deep we're getting. We want to make it pretty uniform white all over, and that happens because the top layer of the skin has these proteins that get denatured, and when it gets denatured it turns white.
One good push and the baby's here, honey.
Perfect. Now we're going to do underneath her eyes and on her nose.
Do I get to go home with pain pills?
Of course you can. What's going to happen with her skin is the whiteness is going to go away within like 20 to 30 minutes. She's going to be extremely dry. Actually, you're going to look like you have a lot of wrinkles. It's going to look like a 70-year-old skin. You got to moisturize up a lot. Within a day or two, the top layer of your skin is going to be coming off. It's going to be very flaky, but do not peel the skin. Let it peel off on its own. Don't try to peel off the layers. Within the next 7 to 8 days, the peeling is going to be more complete. A lot of extra flaking and skin's going to come off. You're going to have a very reddish looking skin. Now that reddish looking skin is basically rejuvenation of your brand new layers of your skin underneath. It's going to give you a beautiful young baby skin.
Day one, I'm still in the office and barely talk. I'm totally in shock right now. But beauty has its price and looking younger has its price. So I look terrible right now, but it's going to be really worth it, and you will see. I'm going to have some bad days ahead of me, but I'm really glad I'm doing it. And if you're going to do it here with Dr. Khadavi. He's the best.